Hey y'all, it's Dr. Stacy again. Okay, I'm coming to you with my unfinished looks. I feel like I cheated y'all with the last video with my lip. So I'm back with another video to give you a red lip. I consider it pink, but since I have on black and white, you know, the most pop is going to give you pink, or going to give you red. Now, what I will say, guys, is that there's something else I wanted to discuss about this home birth. I wanted to give you a possibility, especially for you first-time moms. Remember, your hips, your vagina, nothing has really had anything the size of a baby come through, right? So there's a chance of you to have what we call an OASIS. What does that stand for? Obstetrical anal sphincter. Yeah. So anyway, you can split from the rooter to the tutor, right? As your mother used to say, you can split from the top to the bottom. So it's truly serious, because only certain people are even trained to repair those type of lacerations. Those lacerations run from what we call a 1st degree, 2nd degree, 3rd degree, and 4th degree. And as you probably guessed, the 4th degree is the most major. Okay, it involves the first. Well, the 1st degree only involves like the skin of the vagina. Okay, and maybe just like, you know, superficial mucous membranes, just the very top, right? And then you go into the 2nd degree, which will involve the muscles of the perineum. And, you know, you have little triangle of muscles down there that go all the way back. And remember, I call it UVA. Well, I guess you can call it CUVA, your clit, your urethral meatus, or your urethra, your vagina, and your anus. So they're all there in contact, right? So if you split, any one of those can be involved. The 3rd degree is where we start involving our anus. Okay, this is Russian red MAC, y'all. Russian red. And you can get these for about $12 to $14 at MAC. Okay, don't waste your time on the big ones. Okay, so those lacerations require more training, especially the 3rd and 4th. So the 3rd degree is going to include your anal sphincter. So that's where you poop out of, right? The area down there that squeezes. And then when you start getting into your rectal mucosa, where the vestibule, or where the actual poop comes out of, that's called a 4th degree. So sometimes I tell my patients, hey, I'm going to reach in here and do a rectal exam, because I want to make sure that mucosa is in contact. Because remember, the baby's head comes down like this. Oftentimes the back of the head is this way, and you got a nose and all these things that can just rip through that lower vagina, and right under the lower vagina is the rectum, right? So we call those 4th degrees. Most midwives are not trained. Well, I don't know of any midwives that are trained to repair those. So let me tell you something that can happen if you're at home with a vaginal delivery and you deliver and have a 4th degree. Your midwife may have to leave you hanging open, transport you to the hospital bleeding out, and get that repaired. Okay, I think, you know, I'll never talk about actual patients on my channel, but it can happen. So that is one of the risk factors for having a vaginal delivery. I'm sorry, a home birth. You can tear, rip, and not be in the hospital. And when you're bleeding, that is an increased risk of infection and hemorrhage, right? Okay, y'all, look, I got my new lippy on. It's a mix of a matte, okay, by Kisses. That's the outer. And then my inner, I have, this is called Nick Ack New York. Okay, that is some of the inner as well, and it's a really bright red. I probably should have put this one on before I put the Russian red on, or I could have just not put the Russian red on and just used this so to make it really bright. And when I'm wearing black and white, I really like the colors to pop. Okay, it's Dr. Stacy. Uteruses and cuteruses, because we cute today, right? I love to wear my red lippy and pink lippy when I know I'm gonna be out. So yeah, I'll be back later to talk more about just anything women, anything girls, and to put on my makeup because I love it. All right, y'all. Peace out.